Hello, everyone. It's Phil at Healthcare Business News once again, and today I'm joined by Imran Cronk, the CEO of Ride Health. Did I get your name correct, Imran?
You did. Nice to be with you.
And I read an article in the April issue of Healthcare Business News about what Imran is doing, and it's such a unique service that I was compelled to reach out to him. Imran, tell us briefly about from a high level, what it is that your company does.
Yeah, so Ride Health, we're based in New York, and we focus on building or strengthening existing enterprise transportation programs for hospitals and health systems, as well as for managed care organizations across Medicare and Medicaid, as well as with societies and foundations and life sciences companies. So at the center of it all, though, is a web-based platform that allows care managers and social workers, sometimes with integration into their EHR or CRM platform, to coordinate rides on behalf of patients of theirs who are facing transportation barriers to care. And we connect out to a national network of transportation providers across all levels of service, from public transit to ride hailing to non-emergency medical transportation providers.
Now, why would a healthcare provider rely on your service and just not go directly to Uber or Lyft or their local transportation company?
Yeah, great question. And many coordinators and social workers for decades have been finding ways to help their patients, whether it's calling up a local cab company or experimenting with services like Uber and Lyft. And these can be great options from an episodic perspective. The thing that's missing, though, is the system that ties it together and creates a streamlined experience, not only for the care manager or social worker who is really has a lot of things going on and needs to have a focused place to go to make sure mobility needs are met, but also for the patient so that they can have a consistent experience regardless of the type of transportation service they're receiving. And that's where Ride Health comes into play. So it's really an enterprise platform for large scale transportation programs to make them work for all stakeholders.
How does it work for the transportation provider? Why wouldn't they see you as in the way of their revenue model?
Yeah, so for transportation providers, their main focus is on day-to-day operations and getting the drivers to the pickups on time, getting folks to their appointments or destinations on time, and they don't have a whole lot of time left over for business development. Some of them do, but many of them don't. And so for us, we can help get them access to trip sources that they otherwise may not benefit from, whether it's health systems or health plans, and we pay them, the transportation providers, directly, so they don't have to go and chase the hospital or the health plan from a collection standpoint. So it really streamlines their business and lets them focus more on their day-to-day operations.
And what about the patient? Is it an easier or more difficult experience for the patient?
Yeah. So in general, we're working with patients who are who are experiencing transportation barriers, either because they're lower income and have trouble with affordability, or they're elderly and may have trouble either walking independently or having trouble driving themselves, or folks who have other types of physical mobility limitations and disabilities. And so because of that, we were built without the assumption that the patients would have a smartphone, that they would live in an urban area, that they would walk without support, and that they would speak English as a first language. So really built with the principle of accessibility from the ground up, so that it is a good experience for patients, and meeting them where they are, no matter where that is.
Now, how about during this COVID environment? Has your business model changed as a result of COVID?
So our business model itself hasn't changed. The underlying need is still there, but the way we've had to deliver services and coordinate among stakeholders certainly has. And so, as you might imagine, we're at the center of a pretty unique marketplace or ecosystem. You have immune compromised patients who are getting into vehicles with drivers who are on high alert as they have passenger after passenger in their car, not sure if they're being exposed. And then you have these facilities that they're going to that are in many cases overwhelmed, especially in the Northeast back in March and April. And now we're seeing waves across the country from coast to coast of facilities getting overwhelmed. And then you have health plans kind of at the center of it all from a financing and care management standpoint, who are seeing an expansion of their scope of social care. So because we're at the center of all that, we have been quite impacted by the pause or slowdown in non-emergency care. And so what we've been focused on is sustaining access to life-sustaining treatments for people who still need to get to cancer treatments, still need to get to dialysis appointments. But then also we've been responding by providing COVID-equipped rides for hospitals to be able to discharge patients or bring patients in when they are either confirmed or suspected to have a COVID diagnosis. We've also been doing home delivered meals to older adults who are homebound, and health plans are making partnerships with food pantries and grocery stores to deliver meals and groceries to those members using Ride Health. So we've really had to adapt our product to enable a lot of that. And some of these things really weren't on the roadmap, of course, before COVID hit. So that's been the guiding principle that's led us through this experience, is being there for our stakeholders and rethinking a lot of our core assumptions.
Well, it's a really, really interesting idea. It's not often you see an idea that's so unique that you haven't heard of it before, but this is an example. So how's business?
Well, we've certainly had ups and downs this year, as most businesses, I think, have had, all businesses probably, especially one, where we're at the intersection of health and mobility, two industries that have been quite impacted. On the whole, we are continuing to execute according to our plan for the year. We were able to make it through so far without having to do any layoffs or any salary reductions or any new fundraising. And so those have been some guiding principles and objectives of ours. So, we still have a belief in the fundamental mission that we're pursuing. And sometimes the day-to-day looks different when the world changes. But, we're here for the long run, and we're confident in that trajectory.
Well, it's a very interesting concept. Obviously, you're an innovative fellow, and we appreciate you spending time with us today and wish you success, because if you're successful, it's good for everybody.